Good morning, everyone. I want to show you something. Do you know what this is? Can't see if you can really tell exactly what it is, but it's a quarter, if you don't know. This is actually what is done during abortions. A baby is this size when abortion is performed. So I want to discuss the problems with abortion. I am pro-life. I don't feel that abortion should be an option. The problem with abortion is that it takes life of an innocent child. Life begins at conception. There's many health risks that are involved, and I'm going to explain the physical and mental problems that can be caused by abortions. The health risks involved are that abortions can be linked to breast cancer, and they've actually had studies done that do prove that breast cancer is linked to abortions. A woman is at greater risk of breast cancer for if they've had multiple abortions, and these are induced abortions who have carried fetuses to full term. Abortions can cause a decline in health of women who have them, and this means that a woman who undergoes abortions are at a greater risk of mental problems in the future. There's also been studies showing that there is multiple treatments that are used to help a woman who has went through these mental problems, and it usually consists of 9 treatments. Next, I want to explain the various methods of abortion. Now, I will forewarn that there is some images that can be graphic, and some of the things that I will explain to you are very graphic in detail, and I do caution you that if this is something that's going to make you sick, don't watch. This is not for the faint of heart. Some of the images I will show you are of aborted babies. These methods are used to abort the pregnancy. In-clinic abortion. These usually cost anywhere from $300 to $950 in the first trimester. There is multiple abortions that can be done all the way up to 35 weeks. That's right, you heard me, 35 weeks abortions. These medical procedures, they end the pregnancy most of the time. They can be very effective. You've also got the abortion pill, which is a very common thing you may have heard of. These medications can end early pregnancies, but not late pregnancies. These can cost anywhere from $300 to $800, depending upon the early that the pregnancy is and what type of medication it is. There's various types of pills that are used to abort the pregnancy. Now I'm going to discuss the procedures that are performed during certain stages of pregnancy. From 8 to 10 weeks of pregnancy, you can have what is considered a suction abortion. These are performed using a small tube requiring little dilation for the cervix. This is also considered a menstrual extraction. A lot of people have these done early in the pregnancy, and they're also used for women that are that have menstrual problems as well. This will also help with that. 12 to 18 weeks. This is when a baby is a little bit bigger. They're moving around more. There's more visibility to the baby's face and features. This type of abortion is, instead of a loop-shaped knife used in a D&C abortions, a pair of forceps is inserted into the womb to grasp part of the fetus. Now, this is a pretty terrifying thought, but the teeth of the forceps twist and tear the bones of the child. That's right, you heard me. It pretty much pulls the baby apart. This process is repeated until the fetus is totally dismembered and removed. Usually the spine must be snapped and the skull is crushed. Also, there's another thing that can be done, and it's called a salt poisoning. And it's just a saline injection into the amniotic fluid, and the baby will suck it in when they swallow it, and it causes a burning of the outer layer of skin. And usually within 24 hours, labor will set in and the mother will give birth to a dead or dying baby. Not all cases is the baby completely dead when the mother delivers. When this happens, the baby is usually left untended to die. It's very sad. There have been a few that have survived and later been adopted, and they do have very serious skin problems. At 6 months, there's another chemical abortion that can be done. And this form of abortion uses chemicals that are developed which cause the uterus to contract intensely, pushing the developing baby out. This is forcing a labor, a very, very hard labor. The contractions are so violent and they're not normal, so the unborn baby is frequently killed by them, and some have been decapitated. And this is all done just to abort a 6-month-old baby, a 6-month in the womb baby. At 30 weeks, we have what is considered a partial birth abortion. And this is the most horrifying thing that anybody should do to an unborn child. And I don't know how any type of physician can do this and sit there and look at what they're doing. And it's very graphic. Guided by an ultrasound, the abortionist grabs the baby's legs with the forceps. The baby's legs is pulled up into the birth canal. The abortionist delivers the baby's entire body except for the head. The abortionist jams scissors into the baby's skull. The scissors are then opened to enlarge the skull. The scissors are removed and a suction catheter is inserted. This will remove the child's brains, causing the skull to collapse. The dead baby is then removed. We are talking a partially full-term baby, a large baby that they're doing this to just because somebody didn't want it. So far, I hope that you are disgusted by what you heard. I hope that you're appalled that I even mentioned these ways of abortion. I feel that we don't know what has happened unless we are told. We don't see it, we forget it. If we hear it, if we see the pictures, if we see that this is reality, this is what happens, we can make a change. We can go pro-life instead of pro-choice. We can cause change in other people. Let's save another woman from dying from these procedures. There are serious complications that can occur from these procedures, and these serious complications can be blood clots accumulating in the uterus, infections, tears in the cervix, perforations of the wall of the uterus or other organs. If you're not sure what perforation is, it's a puncture. And this has happened a lot. I found a lot of videos, 911 calls from these Planned Parenthood places that do them, where the physician has actually perforated the uterus and the woman would hemorrhage. There's also a thing called missed abortion, where the abortion wasn't completely killed. It was still alive, so they would have to go through another abortion again. Then there's called an incomplete abortion, which is basically about the same thing. excessive bleeding, which requires a blood transfusion. A lot of these women that have these late abortions end up being rushed to the hospital because of some sort of serious complication. We need to save the lives of women. Offer them another option. There's other options out there. Adoption. Adoption is a big one. Yes, there's a lot of children in the adoption world right now that I know a lot of people think, well, okay, why do we want to put more kids in adoption? Why do we want to let them live in the system? I would rather have a child live in the system. There's foster homes out there that will take care of these kids. There's programs out there that will take care of unwanted children. I would rather go through that than to kill it, to kill a child. They are a living, soon-to-be breathing human being. In my conclusion, let's end this horrific nightmare called abortion. There are too many complications that outweigh a pregnancy. So many women have died or fell extremely ill to these complications. If we educate ourselves in abortion and become pro-life, we can save another woman's life just with the gift of knowledge. Thank you.